Hey, Dr. Romano. So my internship that I did was at Atrium Health in Concord, North Carolina. Some things that I learned while at my internship were how to check blood pressure, how to put telemetry monitors on patients, as well as leading classes that included cardiac patients and also pulmonary patients. And when it came to those classes, I felt that I was very confident while doing them. Sometimes I instructed them with weight training, which included band work as well. So weight training included just dumbbell training, and also I instructed them with relaxational classes, which were that we sit for like 15 minutes and we get the patient's heart rates back to normal, and then we send them off. I also instructed them on how to use like the machines if any of the wellness members needed to learn how to use a machine. I instructed them on doing that. And one of the things that I felt was very challenging whenever I was on the internship was that it was a little bit uncomfortable for me whenever I would do the dances with pulmonary in the beginning. But as the weeks went on, I felt like I was getting better and I was leading it more properly, and I was getting good feedback from the patients saying that I was probably the best one that led it so far and that I should be leading it all the time, which made me more encouraged to be able to lead it every other session. So, just that was probably the hardest thing, was just stepping out of my comfort zone to be able to perform well. And then one of the biggest takeaways that I could get from this internship was that I believe that we should take public speaking more seriously, because I felt like I succeeded in my internship really good, and I did really good due to the fact that I had public speaking history and I knew how to talk in a professional manner to my patients as well as my coworkers. And also, I feel like it's very important that you know what you're saying, because patients that go there know what they're suffering from, know what they need to do, and sometimes those patients, that if you tell them something wrong, they'll correct you. So you need to make sure that you know what you're doing. You need to make sure that you stay on top of your patients and that you keep on encouraging them to perform better so that they can graduate and go on and be live on healthier lives. But I feel like that's like the biggest takeaway that you can get from this internship. If us students did that before internships, I believe that we would have a higher success rate while we're doing internships. But overall, this internship really taught me a lot. It taught me that this is probably like a job that I want to do for the rest of my life, and I really enjoy doing it every day.